Hello class, in this video, this last video for acid-base physiology, I'll be talking about compensation. How does the body correct the pH on its own? So remember back to, again, slide 5 with the equation. So what is coming into the body through cellular metabolism and other metabolites, other metabolism and other ingestion, there has to be a way for the equilibrium to be still remain in homeostasis equilibrium for things to exit. So we have respiratory to exit CO2, and then we also have kidney balancing out the hydrogen and the bicarbonate ions. Okay, so let's take a look at first respiratory compensation. So in respiratory compensation, this depends on how good the patient's respiratory system is. For example, if a patient with severe emphysema has acidosis, respiratory acidosis, obviously the respiratory system, if it's severely compromised, are not able to correct. Although the patients will try, the respiratory will try to change that pH, but if it's severely obstructed, then there's not a very quick compensation from respiratory system. Okay, so let's take a look at what's going on here. So when you read the problem, and if it says, oh, the patient has blood acidosis, okay, it could be metabolic acidosis, right? Well, you want to really think about if you were in the hospital and you're a nurse, you're taking a test of that patient's blood. Well, what does the blood look like? So one good practice is to, when you see blood acidosis, well, look at what the composition of the blood might look like, right? First off, so I drew a little blood vessel here. First off, the blood might be low pH, which means there's a high concentration of hydrogen ion in the blood, and maybe low levels of bicarbonate to accept hydrogen ion. So there's an imbalance between the two. And then, or an excess of PCO2 in the blood. Okay, so when you look at this, and we're looking at respiratory compensation here in green, what you're looking at is the low pH and the high PCO2 in the blood are very strongly sensed by the chemoreceptors. Okay, so the chemoreceptor picks up that we're in blood acidosis and there's a high concentration of PCO2. That becomes a strong stimulator of the respiratory center in the medulla and pons region. And the respiratory center will then deliver a stronger, deeper ventilation, so increase in ventilation, right? So that's gonna blow off the CO2 from the blood, push it out of the lungs and out into the atmosphere. That should, as more and more CO2 is blown off, then that should bring the PCO2 down. So we're taking the high PCO2 and blowing it off, decreasing the PCO2. That in turn will decrease the hydrogen ion in our blood and return our blood pH to normal. So here looking at the end result. So what we started off with and what the respiratory system did should return the pH to normal. And okay, and you can think about alkalosis the same way, okay? But it's obviously different. So same thing, you wanna look at the blood composition of a patient with alkalosis, okay? So higher pH, too little CO2, then that should then inhibit the respiratory center, telling your breathing muscles not to breathe as much. So you might notice a patient having shallow and slow or shallow breathing, okay, not venting as much, hypoventilation. That will trap the CO2, okay? And when you trap the CO2, the PCO2 in the blood goes up and pH should go down to return to normal. This is also called rebreathing. Sometimes in the hospital, if you want to trap that CO2, you can give a patient like, you know, a mask that doesn't have oxygen or anything. You put the mask over the patient and then they're rebreathing the CO2 they're exhaling out. So in a couple minutes, that should correct the PCO2. Okay, this is the same thing when someone having an anxiety attack and they're hyperventilating. You give them a brown paper bag, and the brown paper bag, it doesn't have to be brown, it could be any color. The paper bag, and they're rebreathing that CO2, trapping it back into the lungs and then increasing the PCO2 in the blood. Okay, so that is respiratory compensation. Again, really, when you look at these notes, don't just kind of read it. Take a moment to give yourself a problem like, okay, if I have a patient with ketoacidosis, draw out what the blood looks like and really think about what ketoacidosis is going to do to that patient's respiratory muscles and what is the final consequence of the blood, okay? And in the hospital, if a patient's on a ventilator, how then do you think about adjusting the ventilation rate? So it's a very important concept to correct pH. Lastly, we'll finish with renal compensation, okay? So the renal compensation of acid-base imbalance takes hours, but is very, very effective, okay? So such as if you think about it like a patient with COPD, okay? If they're still able to breathe and things like that, but not as well, and they're still living in the pH and is normal, and they're still living a fairly normal life, it's partly because the kidney is able to correct a lot of that. Once a patient with emphysema have renal failure, then now you have a major health crisis there, major problem. Okay, so let's take a look at how we balance it. So first off, there's a couple key points you really need to understand. One is that the hydrogen ion in the kidney is always secreted into this direction. So hydrogen ion is secreted, so S for secretion. That means it's out of the blood, here you see the blood vessel, into the urine, okay? So that's hydrogen ion secretion. Reabsorption of bicarbonate is that you're regenerating or reabsorbing the bicarbonate, taking it from the kidney tubule before it becomes urine, right? This is all in the kidney tubule. Back, reabsorbing it back to the blood, okay? So reabsorption is always bringing it back to the blood. So you cannot change the direction at which hydrogen and bicarbonate moves. So hydrogen only moves out of the blood and bicarbonate only moves back to the blood. However, you are able to change the rate. So you can increase the rate of secretion or decrease the rate of hydrogen ion secretion. And same thing with reabsorption. You can increase the rate or decrease the rate of reabsorption of bicarbonate. So let's take a problem of blood acidosis. Again, the minute you think about a patient with blood acidosis, I want you to write out what does the blood look like, okay? So it's lower pH, acidic, and there's high levels of hydrogen ion and low levels of bicarbonate ion. So we're looking at these two ions. So that's what's going on in the blood. So if you think about the blood vessel, that's what's going on. So if that's what's going on in the blood vessel, what you have to do is that the renal compensation has to, if there's too much hydrogen ion in the blood, you want to increase hydrogen ion secretion, throwing it out into the urine and out of the blood. Okay, so that'll help you remove the excess hydrogen ion. Bicarbonate is too little, you want to make sure you bring more back. So you want to increase the rate of bicarbonate reabsorption to the blood. So you notice that to correct acidosis, you're going to increase hydrogen ion secretion and increase bicarbonate reabsorption. And in the end, you will then increase the blood pH to normal. What is going on with the urine then? If you test the patient's urine, what would the pH of the urine be? Well, the pH of the urine will be acidic. So you want to think about, because the urine now has higher levels of hydrogen ion, but lower levels of bicarbonate ion in the urine because of what happened in the tubule. So when that happens, the urine is actually acidic, right? If you want to think about it another way, if the blood is acidic and the kidney is compensating for that, you're peeing out the acidic problem. So the pH of the urine should be acidic. I want you to practice doing that with blood alkalosis. So really think about blood alkalosis and practice drawing it out and thinking about the rate of hydrogen ion secretion and the rate of bicarbonate reabsorption. And I also have a few practice slides as well to help you practice. So you want to practice a lot and take the practice quiz and really understand what you're doing, because there's a lot of up and downs, you know, like acidosis, low pH, high hydrogen, hyperventilation, hypoventilation. So to get your head wrapped around all the ideas, you want to make sure you're practicing a lot. Otherwise, it's very easy to make mistakes. If you have any questions, please feel free to email me or contact me or come to the office hour to get questions answered.